Good afternoon, everyone. My name is Kim Stevenson, Director of Workforce and Clinical Affairs at the Massachusetts Health and Hospital Association. I want to welcome you to today's webinar, Path to Profitability, Optimizing Workforce Operations to Achieve Sustainable Labor Costs. A few logistics before we start. If you have questions during the webinar, please enter them into the chat feature as we are in listen-only mode. The questions will come directly to us, and we will do our best to address as many as we can both during and at the end of the presentation. I also want to take a moment now to thank MHA's 2024 sponsors for their support in underwriting today's webinar, which is just one of many events that we have to offer throughout the year to connect our members with leading experts to help address timely issues like this one. I'm pleased to introduce our presenters for today's webinar, CareRev's Joe Anzalone, Chief Strategy Officer, and Susan Pasley, Chief Nursing Officer. Joe Anzalone is the Chief Strategy Officer for CareRev. In this capacity, he oversees strategic partnerships, sales, and marketing strategy, and advises on product direction for CareRev health system customers and channel partners. As the Chief Nursing Officer at CareRev, Susan leads CareRev's clinical strategy and vision. With over 20 years of experience in nursing, patient experience, and clinical solutions, Susan brings a unique perspective and expertise to the intersection of healthcare and technology. Thank you all for being here today. And Joe, I'd like to hand it over to you now.
Thanks so much, Kim. It's really great to be here. And let me just get my screen share going before I get started. Just a moment. Okay. Hopefully y'all can see that. And I want to reiterate how great it is to be here. I'm from Belmont, Massachusetts, so it's great to speak with the association today. I was born at Mount Auburn Hospital, so I don't live there anymore, so it's kind of great to talk to my fellow constituents again. And Susan, if you want to just say hello before we get started.
Yes, thanks, Joe. I agree. It's such a pleasure to be here and to be able to have the opportunity to talk to you all. There may be some familiar faces in the crowd. I've spent a lot of time working with hospitals and health systems in the Massachusetts market with various organizations that I've been with. So it's great to be back with the Massachusetts folks with CareRev.
Thanks, Susan. And for everybody's information, I might just throw out a few questions while I'm talking to kind of make this more interactive. And if you have a comment, just pop it in the chat, okay? And if not, that's okay too. So path to profitability, what are we talking about here? I'm going to start with making this kind of high level. So today's agenda, I'm going to talk about the landscape and what we see as market trends and how those are affecting, our customers, our caregivers, and the market at large. And then go into kind of what I believe is the new normal around fixed cost control for health systems and, in healthcare in general. And then Susan's going to jump in and, be far more coherent. And she's going to talk about how our per diem at scale solution works. Susan promises not to get too pitchy here. She's just going to show you exactly how it works and why it works. And then we'll show you a couple of client case studies and take some questions. I don't expect that our presentation portion will take the full hour. So hopefully we'll have lots of questions at the end and you'll all be super interested in asking some. So let's get started. So I want to start with a very high level concept, the concept of a black swan event. I'm sure many of you or all of you know what a black swan event is. It's something unpredictable, beyond something normally expected that you could not have necessarily planned for, and has potentially severe consequences. A long time ago, I worked in financial services, and this is something we talked about a lot in black swan events in financial services with things like, the housing market crash, stock market crash, things like that. In healthcare, canonical examples include things like what we saw with COVID-19 and other, outbreaks, things that weren't expected. Just in the chat, anyone, can anyone think of another black swan event? Pop it in there. And I'll check this kind of things as we talk. But something like you couldn't have predicted that changed an industry, and the industry had to change because of it. So when I'm talking about a black swan event, before I get to the healthcare and COVID example, I'll give you just a quick example of the airlines. So I don't know, how many of you have traveled in the 1990s? But I used to be in a lot of business travel in the 1990s, and we used to have things in the 1990s called half full flights, or go meet my relatives at the gate when they land. I don't know if you remember that, but life was a lot different back then in air travel. And not only were there, from a security perspective, not as much, scrutiny on security, but financially, airlines did not try to squeeze every single penny out of every single seat. What we saw when 9/11 happened was a severe impact, obviously, in the airline industry. Demand dropped as much as 70 to 80% for a certain period of time. And they then had to learn how to manage revenue in a much more on-demand way. And that also followed up with like technological advances like kiosks and less labor actually in the airports and things like that. It fundamentally changed that industry. Now, some of you might be thinking it didn't necessarily improve the customer experience. That we could debate that, but there's no debating that it changed the industry. And the reason why I mentioned the airlines is that black swan event exposed how complex and interdependent systems were, from reservations to ticketing to pricing to flight scheduling to book. It's a very interdependent system, and they saw flaws in their contingency planning and realized that there was some inflexibility in those top-down systems, and they had to replace them with more open, nimble, as a service, like on-demand type revenue management systems. And as a result, we have what we have today. Every time you go to the airport, there's heavy security, but not just that. They ask you what? When you get to the gate, they ask you, can you just, check your bag, like while you're here? This flight is full. If you're in group 4, you might as well check it now. Otherwise, it's not getting on. Like every single seat is taken. They figured out a way to manage that demand. In healthcare, our most recent black swan event is obviously the COVID-19 pandemic. And what we're seeing as a result of that is a heavy pressure on margins because of a lot of spending for labor and excessive spending on labor during that crisis period. Particularly with staffing companies, contingent labor, but that doesn't mean there wasn't additional spend on internal labor. You needed to get people in the door. It was a crisis situation. And what we saw is pressure on both sides. On the caregiver side, extreme pressure, and on the hospital system side, extreme pressure. And now what we're seeing is some degree of spend normalization in that environment where health systems have realized, okay, we had to, by necessity, make sure that we had enough caregivers and enough care for our patients during that crisis. Now we take a look at that, 2 to 3 year period, and we say, how can we now manage for the future? And that type of fluctuating demand really impacted rates and costs that health systems were paying, right? And I can tell you that, CareRev was in business during the pandemic. We definitely had a lot of business due to those spikes in demand, but now we're in kind of a new post-Black Swan event world where health systems have to find a way to manage this nimbly, using technology in a cost-effective way, particularly when you consider that you probably hear this in other webinars and things about the staffing crises that are out there. There may be a legitimate debate to talk about, is there a nurse shortage, or have nurses left the workforce and would they like to come back? So we're going to get to that, and Susan's going to talk a little bit about that as well. But this is kind of what we're hearing from our customers. And the third-party data says the following, and I thought this was super interesting. The Academy IQ ran this data, like 24, 26 major health systems around the country, including some in New England. And chief nursing officers, this isn't a typo. These 3 were tied for their #1 strategic priorities. Virtual and hybrid care models, enhancing employee safety. There was an influx of workplace violence as a result of pandemic and in its aftermath, and evolving staffing models to be more adaptable and flexible. So I think you might expect this from our chief nursing officers in managing their organizations. But on the right-hand side are chief strategy officers of health systems. So I'm a chief strategy officer. And in health systems, I look at things like new opportunities, business opportunities, like how can we use technology to enhance our products to go to market? Typically, chief strategy officers are looking at things like that: mergers, acquisitions, technological advances. How can we, expand the reach of our health, different hybrid health models? But their #1 priority in this survey, which was taken recently, like 6 or 7 months ago, 2023, financially sustainable tactics to address staffing shortages. Now, for a strategy officer, that's unusual. It's the first time in the 20-year history of this survey that that has come up as number one, or even in the top three. So what this tells me is, and obviously there was a CFO survey, a CIO survey. What this tells us is managing this labor issue in a nimble way is crucial, because we just had an unpredictable event that changed our worlds. And we saw how that put stress on the system, on the financial system, on the caregiver system. How can we manage that nimbly going forward? So, and by the way, it's our caregivers, it's also our nurse managers, right? If you look at the right-hand side of the Academy IQ study on nurse management, nurse leadership, registered nurses, flexible work is like their number one priority nowadays. And for nurse managers, it's also a fairly significant priority, as well as minimizing burnout. We don't want to see burnout taking caregivers out of the workforce. And what we've seen with CareRev is, given flexible options and given the option to use technology, they want to return to the bedside. But the Black Swan event really rocked the worlds of both sides of this equation, right? But this is, I think, really important to understand, is how can we manage this workforce in such a way that everybody wins? Like FTEs and internal pools and internal label sources win, nurse managers win, and caregivers coming from the outside also win. And the future of this workforce, in our minds, is flexible. Another survey taken of the workforce shows that younger nurses make up a large part of our pool. They will come back to the workforce if they're given flexible options, and many of them have left the workforce. So again, we talk about a shortage, but how severe would the shortage be if these options to work flexibly, using things like mobile device, everybody manages their life now with this thing. I kind of wish that wasn't the case. I kind of miss driving somewhere and no one can get a hold of me until I get there, but this is the way it is, right? So people are doing work this way. They're buying coffee this way. They're managing, movie tickets this way. And the future of work is flexible, and it also involves mobile device. And that's kind of what we've seen with our solution, right? So our cloud systems now, they kind of have to do more with less, and they have to solve this, what I would call, difficult equation. In the wake of the Black Swan event, we have to optimize spend and make sure we're spending it in the right places and reduce or normalize costs, and many of our health system clients have. But also, we need to improve the quality of care as well. I mean, we don't want to reduce cost and also reduce quality. And all of our health systems are looking to solve this equation and also add productivity to their workforce. Like, how can you maybe spend a little less but get more productive? And deploy technology to do that. And finally, I think, which is paramount, accomplish those goals and reduce burnout all at the same time. So it seems a daunting proposition. And the cost problem is the first one I want to talk about, because it's a difficult one to solve. And again, this is not our theory. Like, when we interview our health system clients, this is what they tell us. They provision for a certain amount of capacity, which is represented by this fixed cost line. There's no way to predict this 100% correctly. They say, all right, our fixed costs are going to include our FTEs and any travel contracts that we might need for a specialty. We might need to provision that labor to make sure we have coverage in these certain specialty areas and things like that. So that line might be here, around 70% of total capacity. And then in peak periods, what happens is they have these demand spikes, and they might have to boost the rates. They pay to contingent agencies. They might have to go to their own people and say, hey, can you cover this shift for us? Can you come in over the weekend? We can boost the pay a little bit more. They might need to pay overtime. There's supplemental staffing agreements they might have with their agencies or with their internal pools. And that's how they cover. And then when I'm talking about coverage, I mean that quick on-demand at-scale way. But it's not just that. There's also demand drops that they couldn't have necessarily predicted. And in those situations, in those red areas, that's excess capacity. In that excess capacity situation, they have travelers there and they have full-time staff there, and they've committed to those travel contracts. They can't break them necessarily. So oftentimes what we're seeing with our customers is they're sending the full-time employee home. And that caregiver is now no longer working in the unit, the traveler is. And Susan can speak to this probably a bit better than I can, but that has some effect sometimes on morale, because that you're locked in. There's vendor lock-in risk there. So there's got to be a better way, right, to manage this. And what we've seen is like a lot of the approaches aren't quite right, right? Hiring more, adding travel to your full-time staff, like there's additive fixed costs there that you obviously can't break every time. Pretty much every client we have has internal agencies and internal pools and internal labor sources, and many have done a great job being creative at building that. But they don't necessarily have the technology to deploy that workforce quickly on demand to where you post a shift and it shows up on 100 mobile phones in real time. So they're using existing technologies that aren't necessarily suited for a rapid elasticity model. They might be using Chronos for scheduling. They might be texting those people. They may be using Excel spreadsheet. But we've seen all this. And so it's not quite right for that problem. Now, many of our clients have a vendor management solution, and they simply centralize that, and that's good because like you now have one consolidated place to manage all of your labor, and that vendor management solution and that vendor partner might be managing costs and keeping that down for you. But many times those vendor management solutions don't have, as part of their vendor panel, a way to scale up and down quickly with technology and mobile device. So none of them are like quite right for this problem in this new world. So what do? I mean, do you go hire your way out of it, add more travel contracts? Many of our clients are really trying to go big on the internal agency thing. It's just like they don't necessarily address this particular problem, particularly with the technology. And what we've noticed too is like a lot of like other like staffing agencies are coming out with like a platform. Now they're all saying, oh, we have a mobile device, we have this, we have that, particularly those in the post-acute world, because post-acute has been hit pretty hard by economic conditions. But we've been doing this for 7 years. I can tell you it's really hard to build and manage a flexible work solution at scale. And we also have customers that simply use our technology to deploy their own workforce. So we have the ability to do both. So we believe the future of per diem acute care work at scale is to have this kind of, this isn't the greatest chart, to be honest, because it's not like, but I mean, the whole idea is you have this red area of, some people call them gig workers. I don't really like that because it kind of like associates them with like Uber drivers. Like we're talking about super qualified caregivers who want to get back to work, who want to have a flexible solution, who want to work in their local market. They want to stay in Massachusetts. They want to go work at Mount Auburn Hospital, but they never really had that flexible option before. And even flexible options offered within the health systems had certain requirements, like, welcome to our flexible work pool. You must commit to this many hours a week and work these holidays. Like, there's still rules put upon them, and particularly the younger demographic I mentioned before, they're looking to have the same flexibility, that, maybe like other workers might have. So we believe this is a solution because if you have this solution, right, and I'm going to show you a case study later, you can now reduce your fixed cost line. You don't need so many travel contracts necessarily because travel isn't meant to cover scaling up and down quickly. It's meant to cover, like, we need this person for this amount of time with this specialty to ensure that we're covered because we may have patient volume there. Like what a on-demand solution with technology solves are these demand spikes. So in these areas, you're covered and you're covered at scale quickly. And now you're staffing and spending, in a variable way, not in a CapEx way, but in an OpEx way, to where now you're following this line. And in these white areas, you're no longer spending here. And oh, by the way, now you can now deploy quickly. Like if you have a COVID surge and now you have 75 caregivers that have called out, you can now post those shifts and those can appear on mobile phones and that's covered. You don't have to go to a recruiter and say, hey, can you see who you have? Can you send me some like profiles of people? No, all of that is like pre-vetted for you and it's done through technology. And now you might be wondering, well, how exactly does that work? So now Susan's going to come in and show you how it works. So Susan, I'm going to turn it over to you.
Okay, thanks, Joe. I think you did
I'll drive the slides.
okay. I think you did a really nice job of kind of setting up the problem in this post Black Swan pandemic event. Certainly that need for more flexibility is something that we hear in working with clients across the country. Joe promised you earlier that I wouldn't be too pitchy, and I promise that I won't, but some of you on the call are familiar with CareRev. So let me give you a little bit of information about us as a company, just to level set and orient you to who we are. So as Joe mentioned, we've been around for a long time. We were founded in 2015, so very established in the acute care space. You can see over on the right-hand side that we work with hospitals and health systems in the acute care space, both large and small across the country. Now, it's true and fair that we don't have a big footprint in the Massachusetts market or New England, but we certainly are looking to translate the success that we've had around the country to help folks solve the problems as Joe just outlined them in New England. One of the things that Joe mentioned, and I'm going to hit on this a little bit harder as I just talk about how do you actually address the problem kind of with technology, tactically and strategically. Joe mentioned that ability to do it at scale can be very difficult for an individual hospital or even a big health system. And in the time that we have been doing this, we've filled over 500,000 shifts on this kind of flexible per diem model. So we've gotten really good at being able to do this at scale. We, to this day, for some health systems that we work with, are filling thousands of shifts a month that can be met very flexibly based on what the census demand is. And some of you might have some questions, and please feel free to put them in the chat if you do have questions about, as I go through how this works, about it from the caregiver side. So I think it's important for folks to understand that the majority of the folks who work in this flexible model through CareRev, about 61.4% of them, actually work part-time or full-time somewhere else. And they're just looking to augment with a couple of shifts a month. Typically, our professionals work about 7 shifts a month. And the flexible options that are offered through the CareRev marketplace aspect allows them to be able to do that very well. There is a percentage, about 25.7%, that, as Joe mentioned, have kind of stepped away from the bedside, and they found a way to re-enter the bedside solely through this per diem model, which helps us keep the number of active nursing pros that are working in the market much higher than it would be without some of these flexible options. So that's a little bit about CareRev, but you're probably really interested in our approach to how do we actually take the concepts that Joe described and put them into action in a way that when you have a census spike, how do you actually scale very quickly with that flexible labor or even with your internal labor? And so the way that we approach it is really taking kind of a blend of people, process, and technology to bring all three of those together to create a comprehensive strategic approach to just your day-to-day workforce management. And when I think about workforce management, I mean, at the core of it, what's driving it is that you have a patient that has a need. You have a patient sitting in a bed that requires care from a nurse, a CNA. And when you have gaps in your schedule that don't allow you to have enough staff to be able to care for that patient, that's when the technology and the process can really kick in to very quickly, at speed and scale, get you the right caregivers at the bedside for that particular patient in their acuity and specialty. So CareRev has a very comprehensive platform that can act kind of independently or with integrations into your existing scheduling and staffing and people management software to be able to recruit talent into a system that you might not have had access to just from an employed model. We are able to very quickly onboard professionals from the time that they show interest to the time that they are fully onboarded to your specifications with preceptor shifts can be as short as 13 days. And then they are then ready to come in and start claiming shifts as you do have that variability in your demand. And we have an opportunity to manage those shifts and optimize your workforce. So when you find that gap in your schedule, you can leverage that foundation to, as Joe said, kind of send out the needs to either your internal resource pools. It could even just be your internal employees that maybe are part-time or per diem but employed, who come in and pick up extra shifts. Or it could be to the external per diem pools that we're able to manage, build on your behalf and to your specifications and requirements. So that technology is really comprised of two things. It's comprised of two different technological applications. We've got one on the facility side. These are just a couple of screenshots of what that looks like. And then we have one on the professional side. But let me talk for a minute about our really easy to use, clean interface that manages kind of all of the facility aspects of managing this flexible workforce. So we have a system, as I mentioned, can work independently. You can log into it web-based, or we can integrate with your existing systems. And I think that's a really important point, because we know that everybody's overburdened with a lot of manual tasks in their workday, and that integration allows some streamlining and some automation of tasks that have historically been manual. Gives you the ability to have full visibility into your resources, reporting to be able to make data-driven decisions, and also in-app communication that allows you to reach out to those professionals, whether they be employed or from an external kind of marketplace, to communicate directly with them. So there's no friction, no third party in the middle, which we actually find that our pros find that really, really beneficial as well, when you look at it against kind of traditional ways that a third party agency, we're not an agency, manage that communication between a hospital and the health system and the professional. So with that, Joe, let's just take a quick peek at the professional app. So Joe mentioned that we all manage our lives. He said we buy movie tickets and people can call us while we're driving. I think I probably do about 89 other really important things on my phone as well. And so we've created this easy to use mobile application for professionals or your employees to be able to use and get that information really quickly. As soon as you post something into the app, you post a shift, you post a message, you post a need for a assignment, all of that is immediately accessible to those professionals or employees who have the right specialties or the right qualifications to be able to see that. So we have some kind of back-end sorting and algorithms where we're able to make sure that only the people who are qualified for specific units or floors are able to see open and available shifts. They can claim that very easily. We manage the credentialing process. So if somebody has, for example, a TB test that is expired, all of that is managed through the application to document, capture those credentials, keep folks informed to make sure that they are staying up to date and current. Scheduling is very easy to be able to view shifts, decide which ones you want to pick up and book them, manage the upcoming shifts that you have coming on. They're coming up to actually work. And then we have a really streamlined payment system for anybody who's kind of working external to your health system. So that flexible pool that we manage that allows us to be able to fill hundreds or thousands of shifts on demand in real time based on your census needs. So that's just a very high level kind of overview of the technology. And obviously there's a lot more to unpack there, but I'm not gonna bore you with that. I think what's probably more important is to just give you a sense of why professionals like this type of work, as well as we'll talk a little bit about why hospitals and health systems have really found benefit from incorporating this flexibility into their overall workforce strategy. So from a professional perspective, one of the things that Joe said, I'll let you kind of read these. I won't read these to you word for word, but Joe mentioned that giving folks options is really allowing us to be able to retain folks or bring people back into the workforce who maybe had stepped away. I'm sure that you all encountered in your individual facilities people who really got burnt out during the pandemic. And they took some time away thinking, nursing isn't for me anymore, or I just can't take the physical, emotional, mental demands of it. And so they looked for other opportunities. And in the upper right, Lauren Gaston she's a professional who works on our platform quite a bit. I've spoken to her many times personally about her experience, and she's somebody who actually had made a transition into some management work, and it wasn't quite as fulfilling for her as working at the bedside, but she felt the constraints of the pandemic in a way that really had her questioning whether or not she could stay at the bedside or go back to the bedside. So she was looking at other options completely outside of healthcare, despite a 20-year career as a nurse. And when she found this opportunity to flexibly work that gave her some work-life balance, and to still be very intimately a part of the hospitals and the units that she picks up shifts on a regular basis, it was a game changer for her. And I love her quote here: "I feel alive again as a nurse." We've heard that type of a sentiment come over and over again because people go into nursing because they either see it as a calling or they love the work that they do in helping other folks. We just need to find avenues to keep that passion alive and keep it open so that they can continue to provide that patient care in a way that works for them. So from a hospital perspective, we've seen a wide array of benefits depending on how the hospital or health system really uses that flexible model and the technology that we bring to the table. And it's important to know we come in and meet hospitals where they're at. You don't have to use an external an external per diem pool. It can be managing your internal resource pool. It can be just more effectively mobilizing and managing your employees. It can be technology only. So there's a lot of wide variety of ways that folks kind of integrate with us. But a couple of things I want to call your attention to is that Gateway, for example, really found it beneficial to attract that new talent that maybe wouldn't have approached Gateway under a traditional employee model. So one benefit is you get new highly qualified talent into your hospital, and they get to see what it's like to work there and kind of become a part of your community. For CHS, for example, our technology really allowed them to be able to change how they worked into a much more centralized staffing model. And that actually helped tremendously in terms of creating that consistency and efficiency. And we'll talk just in a minute. I'll have Joe talk about how did community actually do that and what was the ROI that they found from that. But last, I'll just point out for Henry Mayo, what really helped them was they were able to take a good look at their current process and understand where to make process improvement, as well as to eliminate some of the workarounds that they had created during the pandemic. So that technology really enabled them to put a much better process in place and eliminate some of the workarounds that actually create inefficiency, even though we think that it's creating more efficiency. So with that, why don't we dig into community health system? Joe, I'm going to let you talk a little bit about this because I know you spent a lot of time with them kind of talking about how they actually did it and what did they see as a result of it.
Yeah, thanks, Susan. And we're kind of going to close with this particular case study. Community was spending about $30 million a month on travelers. Now, we know there's some health systems that spend more than that. There's some that do less. But the point here is that the pandemic and their spending during the pandemic and the aftermath of the pandemic, like for many health systems, made them reassess, all right, how can we get this spend down? And they weren't really able to hire their way out of it. So we partnered with them and implemented our model. And in about 6 months after implementation, because implementation takes a number of weeks, to where the platform's fully customized for your health system, they're able to get that down to $2 million a month. And obviously now they're spending now on flexible caregivers, but those are far less expensive because you're now staffing in an on-demand fashion. You're not locked in. You're not committed. Travel still has a place. You know, we're not here to beat up travel. Like, we believe it's important that you have travelers to cover specialties for a fixed amount of time. They're just not right for this scaling up and down particular model that post-pandemic, post-Black Swan is so important to normalize costs. But what's interesting about them is they also added revenue from patients, because now they're able to scale up much quicker, because there's this local flexible workforce ready to go with a phone in their hand, ready to pick up a shift. So in one case, you know, they're what you know, a disproportionate share hospital. So if like in their area another hospital closes, they take those beds on. They were able to quickly add 106 beds when that happened, when a regional hospital closed, and add revenue to their bottom line. So it's not simply a matter of cutting spend. It's a matter of managing spikes up and down efficiently, cutting costs, adding revenue, and being able to scale in an elastic way. Like we talked about the COVID surge leading to a nurse shortage, and they were able to cover the gap. And again, I can't stress this enough. They have a situation, they post shifts on the platform, they're filled. There's not the in between steps that tend to slow this down, and it's not managed through several different types of technologies. It's very quick, it's very easy. But the quote I love the best from our client here is when he said, he basically said to me, we're never going to be fully staffed, but we're functioning as if we are. And to me, like, that is great, because not only does that mean from a cost perspective they're being more efficient, but now their full-time employees feel better. Now they're not being floated to a unit where they don't want to work. Now they're working top of license. They're more fulfilled. We're reducing burnout. And really that's what it's about. It's not just the cost part of the equation. It's like, is everybody better off? You know, is there more wellness? Is there less burnout? And that's really important to us. You know, Susan being our, you know, we have a lot of ex-caregivers on our team, on our executive team, and that's something we talk about all the time. So that is essentially our solution and kind of how we see the market, and would love to have a few questions from the group.
And just a reminder, if you have any questions, everybody's in listen only, so please put those in the chat and we'll be happy to take those and answer as many as we can. And thanks again, Joe and Susan. This has been a terrific presentation. So I know I've definitely learned a lot.
Thanks, Kim.
Thanks,
Ask us anything, you know, you can ask, you know, where I grew up in Belmont, you know, I used to work at the Cask and Flagon, if anyone's interested.
Good place.
What are you seeing in your health system? All those things. Credentialing.
We've got a question from Lisa. Could you tell us once again how credentialing is done?
Yes, I can absolutely handle that question. So when we come in and really work to build a flexible pool for your hospital or health system, we have a team of nurses who come in and understand for every specialty that we would be building in our pool. What are the credentials and the requirements, both from a health system perspective? So what are the vaccinations that need to be done? You know, what are the things from an occupational health and just a policy and procedure thing that you need to have in place? But also, what are the certifications? What are the training and education that you would require of your own employees? And so we work through that. We understand, we kind of do all of that requirements gathering. And then we build in the back end system for each specialty, what that credentialing process will look like. And so every RN, every CNA, every type of specialty that comes through our system is kind of held to those requirements that you actually dictate to us. So we want to make sure that everybody who steps onto a unit in your facility has the same high quality that you would expect of an employee. So I'll just give you an example. If you tell us that you're looking for emergency department nurses and in addition to ACLS, you require TNCC. Well, then that's what we would actually vet professionals against. We build that into our system. So on the mobile application side, in the onboarding center, they can see everything that they have to submit that has to be verified. So it's really easy for professionals who are interested to come in and go through that entire onboarding process very seamlessly. And then we actually manage that, all of the verification of credentials for you, both in a combination of people, but also we have some automated processes that help us verify some of those credentials as well. And so you didn't ask, but I'm just gonna make a quick note that certainly for all of our nurses and CNAs, they will get an orientation that is your hospital and health system version of orientation. And everybody does a preceptor shift before they actually claim a shift, and before we open up the ability to claim shifts. But once all of that is done, it's managed just the same as it would be in your hospital, right? Credentials have to be updated as they expire. Annual education happens. And so it's just really an extension of the processes that you already have in place. The benefit is that we manage it for you. And so it's a heavy lift that's taken off of your HR staff, your nursing management, et cetera.
That's great. Thank you, Susan. And I have a question. How long does it take a hospital to get up and running? They say, I want to use CareRev. I want to try this out. Like what's kind of the timeline to getting nurses in the door?
Yeah, so that's a great question. We actually can move very quickly. Certainly we got great at speed during the pandemic because everybody needed things, tomorrow. So what we have found is that actually the rate limiting factor typically is the hospital, and how quickly they can get information to us. When we partner with a new hospital or health system, we immediately start recruiting, and we take on all of that kind of marketing and recruiting effort on our end to get nurses and CNAs and other healthcare professionals interested. Simultaneously, we're working with you on all of that back end information to understand what does orientation look like, what does the credentialing process look like, and get kind of everything set up in our system. But if we don't have major roadblocks in getting that exchange of information, and to be clear, it's very rare that we have major roadblocks, but in 6 to 8 weeks, we can feasibly have nurses like picking up shifts in your hospital. So it can be very quick. It will ramp up for a period of time as we continue to understand what your needs are going to be, and we continue to build that pool. But we manage our pools actively against your, predicted volumes, and make sure that our pools are filled with the specialties that our clients are looking for. So there'll be a little bit of a ramp up period, but it can be pretty quick that we get nurses in the door working shifts.
Terrific. And one other question. I know we talked a lot about hospitals, but you guys supply staff to both acute and post-acute facilities. Is that correct?
So we do. It's interesting. We actually started out in the post-acute space and then very quickly recognized that to do this at scale, there's more demand and more need in the acute care space. And so it doesn't mean that we don't serve a post-acute care space. We do still have some skilled nursing facilities, assisted living facilities, long-term acute care hospitals that we service. Our primary focus is acute care, though, although certainly for larger SNF systems that have a great need for this, that will benefit from a more manageable cost structure as well as that speed and scale. We absolutely have lots of experience in the post-acute space as well.
To add on to your earlier question, when you talked about how long does it take to get up and running, that process is highly bespoke. And because the ultimate goal is once implementation is done, you post shifts, people pick them up, period. There's no delay between that posting and the activation, the engagement with the community of caregivers in your area. So it's all meant to make sure that that becomes an on-demand scalable model. And that's really the magic, is like the technology is simply in service of giving both sides the ability to be flexible.
Mhm.
Thank you. I don't see any other questions in the chat. So I think we can move on to wrapping things up, if that's all right. So that was a terrific presentation. I learned a lot. I'm hopeful that a lot of other people learned a lot. And thank you so much, Joe and Susan, for leading a wonderful session today. If anyone's interested in learning more about CareRev or talking with CareRev folks, they're going to be at our annual meeting on January 25th and 26th. You could see the image for that, the ad for that on your screen right now. So we're very much looking forward to seeing you guys in person and talking more. And if you scan the QR code on your screen now, you'll also see all of MHA's educational programming coming up. We have a lot of events coming this spring, both virtual and in person, and we hope to see you again soon. So thanks, everybody. We hope you really enjoyed this event, and we hope to see you soon at future events. Thank you all.
Thanks, everyone.
Yeah.